I'm Charles Strong III of Strong Counseling Solutions, LLC. We offer on-site counseling in Gretna, Louisiana, and board-approved online counseling throughout the state of Louisiana. For PLPCs seeking to become licensed, we offer supervision. And for mental health rehabs, we offer services of assessment, psychotherapy, and consulting. I recently had the opportunity to attend a discussion by Doctors Belinda P, Boscoe and Thomas A, LaVeist on the inequitable access to behavioral health care for Black Americans. Dr. LaVeist spoke on 3 levels of racism: internalized, interpersonalized, and institutionalized or structural. For internalized, that's people subject to racism believing in the negative aspects. So the example he gave was, it's easier to kill someone over a pair of Jordans if you believe their life is invaluable. For interpersonalized, that's bigotry, where you'll see the media perpetuate the belief system that some people are naturally inferior to others. And finally, there's institutionalized or structural, and that's more like autopilot, letting the way society is organized just play out. This is highlighted by how we don't teach history the way we should, and Dr. LaVeist noted that he didn't know Black Americans fought on both sides of the Civil War until he was working on his PhD. Dr. Boscoe recalled a nursery rhyme where she was jumping rope in Atlanta as a child that went, if you're white, you're all right. If you're yellow, you're mellow. If you're brown, stick around. If you're black, get back. She didn't know as a child she was being taught to hate herself. And that's all this structural level of racism. The doctors talked about equality versus equity and the misconception that they're the same. Dr. Boscoe gave the example that if you have equality, everyone has a size 11 shoe. Now for some people that fits, for some it's too big, and for some it's too small. But if you have equity, everyone has the right shoe for the right foot, and this, she says, doesn't happen nearly as much in the hospital setting. The doctor spoke on disparities, with Dr. Boscoe pointing out that common afflictions for Black Americans include heart disease, hypertension, prostate cancer among men, and mental illness. And a lot of the barriers are stigma and late treatment seeking, which can see otherwise easily treatable problems worsen over time. She says generally a lot of people die with prostate cancer, but because of seeking treatment late or not at all, many Black Americans die from prostate cancer. Dr. LaVeist went further to explain how perpetual fight or flight can be experienced due to where you live. So for fight or flight, if a person is stressed out and they feel they're at risk, the body generates adrenaline and cortisol to pump your muscles and improve your strength and improve your reaction time so you act more quickly. If you live in a dangerous area, struggle to pay bills and maintain stable housing, that sort of thing, your body goes into fight or flight and stays that way. If you're continuously living in that state, your blood pressure is always high, and that starts to break down your organs and develop chronic stroke, cancer, and heart disease, the 3 leading causes of death in this country. So what do we do about disparities? Dr. LaVeist called for community enhancement, stating that in most communities, 14-year-olds don't have access to that first job they need to enter the workforce. Local schools are usually not the best schools due to under-resourcing or higher social service needs, which pull resources from the educational needs. He said you're probably living in a house that is not appreciating at the same rate as white communities, so you can't take out a loan to send your child to college or a private school. You probably don't have access to full-service restaurants or high-quality grocery stores. So he said health, wealth, educational outcomes, and the criminal justice system are all impacted. Dr. Boscoe talked about reading a book in college about the poor paying more, so she hit the streets to sort of test that by pricing products in white suburbs on the far north side and then in the Black neighborhoods. And this experiment she conducted found that products in the Black community cost more than the same products in the white communities. She noted that Black communities are often exposed at a much higher rate to alcohol and tobacco billboards, and even the marketing techniques are different. She said that years ago, an alcohol ad marketed to whites said, "Be a part of what's going on." And in the Black community, it was marketed as, "Be different, separate from the rest." On mental and behavioral health disparities, Dr. Boscoe urged for more resources for prevention and more people of color who represent those fields, saying that the numbers of professionals identifying as Black, Latinx, and Native American are not proportionate to the numbers represented in communities as a whole, and often people want to find someone who looks like them before they open up for counseling. So what action steps are there? Dr. LaVeist said we're never going to live up to the promise of the Declaration of Independence. If we're ever going to live up to the radical ideas of that document, we have to deal with the issue of race and treat people as humans. And Dr. Boscoe said cultural competence is about doing with people, not for people. will only reach equity by moving on from a paternal reaching down into communities to holding hands with people and dismantling the symptoms that perpetuate these issues. That's our talk for today. Hope you learned something or found something interesting. You can find more videos like these on Facebook, Instagram, LinkedIn, or Twitter. We'll be back next week with a new video. So until then, thanks and be well.